Welcome to Better Sex, where you get the information and inspiration to create and enjoy your best possible sex life. Join your host, sex therapist Jessa Zimmerman, as she brings you expert guests, helpful tips, knowledge, and strategies to improve your intimate relationships. And now, your host, Jessa Zimmerman.
Hey, welcome back to the Better Sex Podcast. This is Jessa. Thank you for spending the time with me today. I'm glad you're here. You know, at the time of this recording, I have been producing this podcast for 2 years now. And it's kind of amazing. I just released episode 101, actually, this week. Don't know where I'll be when this gets released, but even further along. And it's amazing to me the variety of topics that I have covered on this show. And lots of them have been my ideas, but sometimes someone reaches out to me. You know, they approach me with a new idea, a new topic, and it's something that really had not crossed my mind before. I either knew nothing about it or it didn't occur to me. And this week's show is an example of that. So Dr. Ben Domb is an orthopedic surgeon, and he reached out to me to talk about hip pain and sex, because what he has seen in his practice, especially working with women, is that they can have a hip injury, a torn labrum, that can refer and create sexual pain. And so he's seen enough of this that he really wants to get the word out. You know, because women with sexual pain will typically go to a gynecologist, but they are not prepared to examine hips and realize that that's the problem. So this is such a great topic for awareness. And while, likely it doesn't apply to you who's listening, someday it may. Or someday you may have a friend who's talking about some pain and you'll be able to say, hey, wait a minute. You should see an orthopedist and get a screening and make sure that's not what's going on. Anyway, fascinating conversation with Ben, and I hope you enjoy it. Ben, thank you so much for being on the show with me.
My pleasure. Thanks for having me.
Yeah, I was intrigued when you reached out about being on the podcast because this is not something I knew anything about. So this is going to be great for me and the listeners.
Well, that's lucky for you. I hope you never do.
Yeah, that's true. I hope I never know it firsthand. So tell me, explain to me, how can painful sex be related to problems in the hip?
Well, firstly, when a woman has pain with sexual intercourse, the first place she typically goes is to her gynecologist, and
right.
Rightly so, because there are numerous gynecologic reasons that can account for painful sex. So that is and should be the first stop.
Okay.
If you look at a long list of the reasons, though, that a woman can have painful sex and you spot hip injury somewhere in the middle of it, that stands out as something that does not fall under the specialty of a gynecologist. And
right.
Therefore, it may not be on their radar screen. So by the time I see women with hip pain, which has been causing painful sex, they've usually gone through multiple doctors to get to me before getting a diagnosis. So to answer your question, how can a hip problem cause painful intercourse? It's actually so simple that once you think about it, you can't believe you never thought of it before.
Okay.
But the positions a woman's hip is required to be in during sexual intercourse in various positions involve taking the hip to its endpoint of motion, to its extreme of motion. And at those endpoints of motion is where the bone hits the bone in the hip joint. So the leg bone, known as the femur, hits against the edge of the socket of the hip. And that hitting, or impingement as we call it in orthopedics, can cause pain. It can cause tears of structures like the labrum, which is a ring of cartilage around the edge of the socket. And it can create a painful and persistently painful condition of the hip.
Okay, so it's going to be pretty clear to a woman that has this going on that the pain is in the hip, right? I mean, it's not like it's radiating out and could be confused with gynecological pain, right?
Unfortunately, not quite right. I wish it were that clear. And I think the fact, if it were that clear, then maybe women wouldn't have to go through multiple doctors to get a diagnosis and suffer with it all that time. Unfortunately, our brains don't do a very good job of localizing hip pain. And it can refer to a variety of locations, including the groin and even the vulva and the pubis. So it can very easily be confused with gynecologic problems or abdominal problems as well. Okay.
And do you find that the gynecologists recognize, wait, I've ruled out everything that's sort of in my wheelhouse, go look at your hip? Is this something that's on people's, in the medical profession, is it on their radar that this could be part of what's causing that pain?
Well, I'm an orthopedic surgeon, and you wouldn't want me doing a gynecological examination. And I think
right.
You probably wouldn't expect a gynecologist to do a hip examination.
Okay.
So it's really not necessarily on their radar screen. And again, through no fault of anybody's, it's just a completely different field. And so a gynecologist isn't taught to examine a hip anymore than I, as an orthopedic surgeon, am taught to do a pelvic exam.
Right.
So I think the awareness between our fields, between orthopedics and gynecology, is really critical. And it's critical in both directions. It's critical for me as well as a hip specialist to understand that there are gynecologic problems that are causes of pain in the area of the hip.
Mm-hmm.
So in both directions, I think sharing of information and awareness is critical.
Okay. Is this an issue for men in sex too? Could they have a hip injury that would also show up as sexual pain, or do you only see this with women?
It does, but it's different. So for men, we see pain that's coming from a hip problem that radiates at times to the genitals, to the penis or the testicle. And in many cases, that can be confused with a urological problem. So I've seen men who had a hip problem all along who visited first with a urologist and were thought to have a urologic problem, and in many cases were treated for a urologic problem. And so too with women. I've seen women who had abdominal surgery for what was thought to be endometriosis. I've seen people who have had hernia surgery because they thought they had a hernia. I even have seen a man who had a groin pain and went to see a urologist and had a spermatic cord nerve stripping done because he presented with groin pain. Now, I'm not even sure what a spermatic cord nerve stripping is really, but I know
it doesn't sound good. Yeah, it doesn't sound like that's got to be your first line of defense there.
No. Well, so the unfortunate statistics are that of the types of hip injuries that I treat, 60% are initially misdiagnosed.
Yeah.
They take, on average, 7 months till they get a diagnosis. And in almost 1 in 5 cases, they've been recommended a different surgery entirely because of the difficulty in obtaining the right diagnosis.
Wow. So how might, obviously, they need to see a professional, a doctor, to get the diagnosis, but what are the kinds of signs that people might have that this might be a hip injury, and not just something that's gynecological? Like, what might people be looking for to at least think, oh, wait, maybe this is what's happening?
So interestingly, when I see women like we've talked about who have struggled to get diagnosed, usually it's the woman themselves that winds up figuring it out rather than any doctor they see. Because they become aware that it's the motions of the hip that trigger the pain, and particularly the extremes of motion. And getting back to painful sex, if they have to bend their hip or bring their leg out to the side or twist or rotate it in any particular direction, and those things trigger the pain, they start to realize themselves, this seems to be related to my hip positioning.
Okay. And it seems to me that hip positioning, I mean, it might come to your attention in doing other things than just sex, getting in and out of the car. I mean, I don't even know, getting out of a bathtub or something, right?
Yeah. No, you're spot on the money. Getting in and out of a car is a big one. Prolonged sitting, rotating. Sometimes we see it with walking or running, but even more commonly with pivoting or twisting, turning, and yes, getting in and out of a car.
Okay.
It's a big one.
So how does somebody tear a labrum? I mean, how is this injury incurred? I mean, I guess there's more than one way, but what are the most common ways that somebody's going to have this injury?
So the most common ways that I see are related to subtle abnormalities in the way that the hip is formed. So the hip is a ball and socket, and ideally the ball should be perfectly round and should fit perfectly in the socket. In reality, very few of us have perfectly shaped hips, and to varying degrees, we may have hips that are out of round. And when they're out of round, you have an oblong ball rotating in a round socket. It eventually wears away at tissue, and eventually it tears. The first thing that tear is usually the labrum, which is the ring around the edge of the socket. So sometimes that happens with an acute injury where somebody's aware of exactly when it happened, whether it's in sports or in sex or with a fall. But more often, it's something that creeps up and develops over time, and still may be related to sports or sex or other things, but can't be pinned to one particular incident. An interesting anecdote that really brought my attention to the relationship between gynecology and care of hip problems was I had a woman come in with a torn labrum in her hip, and I asked her how she tore her labrum in her hip, or how she injured her hip, and she says to me, "My mother-in-law tore my labrum in my hip while I was delivering my baby." That's very specific. So tell me exactly what you mean. So what it turned out had happened was during her delivery, her well-meaning mother-in-law was trying to help her pull her leg up toward her chest, and inadvertently twisted her hip. And incredibly, I'm told that childbirth is rather painful, but the pain that she remembered from her childbirth was her hip pain.
I mean, as you're telling this story, I'm squirming in my chair. And just the idea of somebody moving your leg and tearing this, it's like, right in the midst of childbirth, too. Oh.
Stay away from your mother-in-law.
Yeah. Wow.
So that sort of brought my attention to this idea of the extremes of motion for a woman, causing pain that could be confused with gynecologic pain. This particular woman had naturally been under the care of a gynecologist, and again, she had just given birth, so naturally they were looking for gynecologic reasons for her pain, and it took many months till they realized, the woman herself and her doctors realized this is not a gynecologic problem.
Wow.
It's a hip problem.
Yeah. Hey everybody, it's Jessa, and we're just taking a little break in the show so I can share something exciting with you. At least I think it's exciting. I wrote a book called Sex Without Stress, and I had turned it into an online course, and now I've reformatted it so that you can sign up at any time. It's more like an a la carte thing. For less than $100, you and your partner can work through this entire process, guided through webinars and assignments and conversations to have and real-world exercises to use to take the stress out of your sex life. So if you're in a good relationship but sex is the issue, this could be a perfect fit. And then separate from that, you can opt into my membership group, month at a time, or you can sign up for a whole year. That's where you'll get the personal support while you're working through the process. So it comes with Q&A sessions, bonus content, some guest presenters, and a private support community, like a forum. So that's priced separately so you can just participate in that when it's useful to you. Anyway, if you want to learn more, go to sexwithoutstress.com. And now back to the show. So you said that, commonly we tear our labrum because of the way we're formed, where the hip is formed. Then you've got an acute injury like that if your mother-in-law, moves your leg.
That's a sensational one.
Yeah, that's sort of an outlier, hopefully. But is there a way then to prevent a torn labrum, these kinds of hip injuries? Like if some of it's just the way we're built, that doesn't seem like we could prevent those injuries.
Yeah, so we can't change how we're built, but what we can do is we can accommodate how we're built. So not all of us can or should move our hips to the same degree. So if you look at the average man compared to the average woman, the average man has much less range of motion of his hip. And go to any yoga class and look at the men compared to the women, and you'll see that difference. It's very stark. And amongst women, there are differences. So a woman who has a particular shape of her hip joint may be limited in a particular direction. And what everybody tells that woman is stretch more. You have inflexible hips, and that can actually be the wrong advice. So the right advice in a case like that is understand that you don't have the same motion as your best friend in that direction, and therefore your hips just shouldn't go there. And, this gets a little bit intimate when we talk about sex, because there can be expectations coming from many directions as to how sex should be. And for a woman to acknowledge that the positions that she should utilize or the things she should undertake in sex are not necessarily the same as everyone else, it can at times be a sensitive topic. But that said, that is the way to avoid hip problems caused by sex or anything else, is to understand the limitations of that particular person's hip or hips, and to stay within those limitations and accommodate them rather than trying to push through them, because pushing through them is where damage occurs.
Right. That's where you're going to get the tear. So understanding that our limited range of motion might be our built-in mechanics, not just a matter of stretch harder or further.
Exactly.
Okay. What are the treatment options? I mean, is this something that's repairable and people can get back and, get out of the pain?
Yeah, so I'm a surgeon, so obviously I do surgery, but my approach is to try to avoid surgery whenever possible. So when possible, we try to treat a hip injury with non-surgical measures like physical therapy, sometimes injections, including biologic injections. When those things are not effective and a woman is in pain that she doesn't want to live with, then we can often fix the problem with an arthroscopic surgery, which is surgically my area of specialty. So arthroscopic surgery means keyhole incisions and a camera inside the joint. Everybody has a friend who's had an arthroscopy of the knee or the shoulder, much more common in those joints. Much more difficult to do arthroscopy in the hip because it's a deeper joint and a tighter joint. So it's a much more technical surgery. But over the last 10 to 12 years, I've been fortunate to be a part of developing a number of techniques to repair injuries like a torn labrum or impingement in the hip through arthroscopic techniques, which allow a person to go home the same day and ultimately return to a normal and active life. And in some cases, we can even improve their range of motion and make it better than it was before.
But something like, if somebody has a torn labrum, physical therapy or injections isn't going to heal a tear, is it? Do tears ever heal themselves?
They don't. Yeah, you're absolutely right. So a torn labrum can't heal itself.
Okay.
Having said that, there are people who can live with a torn labrum and not have pain. So when we undertake physical therapy, for example, we know that the therapy won't heal the labrum, but the hope is that strengthening the muscles around the hip and avoiding the painful positions will stabilize the joint such that the labrum stops being painful. Having said that, a majority of people who have a torn labrum and impingement for any period of time are not going to be able to cure the pain with physical therapy. And so although we give them a chance, a majority of those cases likely will go on to need to be fixed.
Yeah. Okay. And is there something that differentiates when arthroscopic, is that what it's called, surgery can be used versus a more invasive type? Is that just a matter of the degree of injury, or what might set somebody up for a more, a longer recovery and a bigger deal?
Yeah, so 10 years ago or more, these injuries were treated through a big open surgery where the hip was dislocated, the ball was popped out of the socket in order to access the hip. And it's a very big and invasive surgery. And as a result, even that wasn't done a whole lot. So most people who had a torn labrum or impingement in their hip lived with it, frankly. And they often lived with it for decades until they wound up needing a hip replacement. So today we have the ability to treat these things at a much earlier stage arthroscopically. So in my hands, a majority of hip injuries that need to have surgery, as long as there is not advanced arthritis, can be treated arthroscopically.
Okay. And does that then contribute or reduce the likelihood that somebody might need a hip replacement someday? Is that related to these kinds of tears, or is that purely about arthritis?
It's very much related. So any joint that we injure in our body is at risk for developing arthritis and is at risk for needing another surgery and a replacement at some point. So no one should have the hubris to think that we can stop the process of arthritis, because we're all getting arthritis in all our joints every day. But I do think we have the opportunity to at least slow it down. And in the cases that I treat, where you have a ball and socket that the ball is out of round, and I can make the ball round, then we make it such that it doesn't rub anymore.
Right.
So we can hopefully slow down, if not halt, the process of arthritis, and if not prevent, at least delay the need for future surgeries and put off or prevent some of the hip replacements that might have resulted from it.
Okay. Cool. So what do people know too? If somebody's been through this, if they've repaired it, how prone is it to recurrence? How likely is it that if somebody tears one labrum, they're going to tear the other? It's going to tear again. Is this? I'd imagine there's some correlation there.
Yeah. So fortunately, of the ones we repair, a very small minority of them wind up needing another surgery in the time period thereafter. 95% of people that we follow for a minimum of 2 years out have done fine and not needed any further surgery at our clinic. But you ask an interesting question about the other hip, because a person who has a torn labrum or impingement in one hip is at greatly elevated risk for developing the same in the other hip. So we don't do preventative surgery or anything like that, but what we do in those cases is we advise keeping a very sharp eye on the other hip. And if it does become painful, then we try to catch it earlier in the process, so that we can maybe prevent it from getting as bad. Okay.
So do you have any, as an orthopedic surgeon, that's, this is your livelihood, this is your focus all day long. Should people ever see someone like you before pain? Do you recommend a screening or some sort of evaluation for everyone, so they're on this kind of stuff ahead, or do you just wait until something hurts?
Yeah, I think screening is a good idea because we talked earlier about how we can identify the subtle differences between people in their comfortable and normal ranges of motion, and we can teach them how to accommodate their normal range of motion. So a screening can help with that. And we do screenings at American Hip Institute where we run people through a series of tests and show them, when they're doing a squat, for example, what is their endpoint. And it's different for each person. Some people can go lower than others. So not everybody in the high intensity training class should be squatting to the same level. And so I think when we screen people at American Hip Institute and counsel them on where they should go and what they should do and how they should modify their activities, our hope is that we actually can prevent some injuries.
Okay, so it'd be worth something. People should consider that, getting a screening with somebody in their area. Okay. All right.
Absolutely.
So, and where would people find, I mean, I'd like you to, say where people could find you, but you're local, I think You're in Chicago, right? And where could people find somebody, nationally, like wherever they are?
Yeah, so the American Hip Institute is a national resource for patients, and it has an online presence and resources for where you can go in every city.
Okay.
They also do, we do remote reviews of films for people from all around the country and around the world, and counsel people over the phone so that they don't even have to go to a doctor's office. So I think the best starting point would be to visit the American Hip Institute website, which can direct patients where to go from there.
Okay, perfect. Anything else that that I didn't ask you that you want to make sure people know and understand?
Well, I think the reason you asked me to the show was, in the first place, was to talk about hip pain during sex for women. And just to close on that point, it can be a sensitive topic and a topic that can be uncomfortable for women to talk about with anyone, with their partner or with their doctor. And I think if I leave the audience with anything, it's that this is something that's out there. It's common. Lots of women have hip pain with sexual intercourse. It's not something to be embarrassed about, and it is something that can be treated and ought to be pursued if it's affecting one's daily life, sexual intercourse, relationship, or other.
Great. Well, thank you so much. I think this is really important, and I'm so glad to, to share the message. So the people that need to hear this are going to hear this. So.
My pleasure. Thanks for having me on.
You are welcome.
You've been listening to Better Sex. Please visit our website, bettersexpodcast.com, for show notes and additional episodes.
And that's a wrap for today. I really hope you enjoyed the episode. If you are enjoying the podcast, if some of this material resonates with you and you would like to make a difference and make sure that this keeps coming out in the world once a week, ongoing, there are a couple things you could do to show your appreciation. The first would be to go to iTunes and rate and review the show. That really helps us be found by new listeners when you review the show on iTunes. You can find a link at bettersexpodcast.com/iTunes. The other thing I want to invite you to consider is becoming a Patreon. For a small monthly pledge, you get some benefits. So for $2 a month, you get advance access to every single episode. For $5 a month, you get a chapter of my upcoming new book. And for $10 a month, I host quarterly get-to-know-you and question-and-answer chats over the web, and you get invited to that. I would love to have your membership in that, become part of the Better Sex family. You can find a link at bettersexpodcast.com/Patreon, which is Patreon. Again, thanks for listening. I'm glad you're here. Feel free to comment, ask questions, get in touch. I'd love to hear from listeners. Thanks.